I thank you, Mr. Chairman. Mr. Holtz-Eakin, beginning in 2014, the Affordable Care Act, the Obama Act, imposes a new tax on health insurance of at least $100 billion. That's an accurate figure, is it not?
Yes, sir.
I think it came that our committee got that from the Joint Tax Committee, so we can live with that figure. That's good to go with. Probably none of the three here deny that figure.
In fact, one of the unprecedented features of that tax is that it demands that a fixed amount of revenue be raised regardless of the circumstances in the industry. So $8 billion in 2014, no matter what.
And the tax begins at $8 billion in 2014 and rises to $14.3 billion in 2018, and thereafter it increases annually based on the premium growth. And I think we're all aware that the tax is going to fall on all individuals and businesses that purchase health care insurance. Maybe less well known is that or less well admitted by the writers of this act. The tax will also hit seniors enrolled in the Medicare Advantage plans, state Medicaid programs, and Medicaid health plans serving low-income families, right?
That's correct, sir.
And can you explain for the committee what kind of impact beneficiaries enrolled in the private Medicare and Medicaid plans can expect to encounter after the tax is fully phased in?
If you look at the structure of the tax, I think there's broad agreement that the tax itself will end up being embedded into premiums, that insurers will have to recover that cost, and the way to do so is raise premiums. A unique feature of the tax is that it is not deductible for purposes of paying corporation income taxes, something that I've never seen before in the tax law. So if you're not a tax-exempt insurer, if you have to pay $1 of insurance of premium tax, and you raise your premiums by $1 to do it, you'll still come up short because you have to pay tax on that $1 as well. So you have to raise premiums by more than $1, actually $1.54 to cover that provision. That's a lot of upward pressure on premiums. Not everyone will be subject to that, so you'll start to see shuffling in coverage, shuffling in lines of business. The Medicare Advantage plans, the managed Medicaids are going to be subject to the same thing. That means disruption in provider networks, higher premiums across the board.
Well, thank you for that. Now, I didn't hear you say Medicaid programs. How will the tax impact the state Medicaid programs? Our governor was in town yesterday and discussed with the Republican members.
It is exactly the same. All these lines of insurance are subject to this, and all will see premium pressures as a result.
Then the yes answers that were extracted earlier by the chairman were based on services that increase or become more expensive. And either of those situations are what you glean from reading the act itself.
Yeah, I mean, the tax is a cost the businesses have to cover, if I understand the question right.
I thank you. I yield back my time.